Hi, I'm Lizzie Zerhusen,
And I'm Jasmine Gibson.
and our capstone project focused around educating nurses in the neonatal intensive care unit about postpartum depression and the resources available to identify and help mothers that screen positive for postpartum depression. Research was conducted, and it was found that nurses in the NICU have limited education on the signs and symptoms of postpartum depression, how to effectively screen the parents of their patients, and what to do if they think one of the moms has postpartum depression. Postpartum depression is prevalent in new mothers. About 10 to 15% of all new mothers experience postpartum depression. We are looking to expand screening and education to increase NICU nurse awareness and ability to catch postpartum depression earlier. Most cases of postpartum depression go undiagnosed due to lack of education on the signs and symptoms of the screening tools that are available. Our PICO question developed for this project was in neonatal intensive care units, does supplemental education on postpartum depression and screening compared to annual education affect nurses' knowledge of postpartum depression and screening? Our first objective in our educational model was that NICU nurses would be able to identify mothers at risk for postpartum depression who have children in the NICU. Our second objective was that NICU nurses would be able to identify the appropriate resources after identifying signs of postpartum depression in mothers and their patients.
So, when asking some of the nurses within children's NICU staff about education they receive on postpartum depression, we found that they are only required to complete annual continuing education module, and the nurses felt that this was not appropriate or adequate for determining postpartum depression. And so we found research that supported the need for more education for nurses in the postpartum unit and NICU. And based on the information, we were able to develop an educational model and distribute it to the NICU staff at Cincinnati Children's Hospital via the educational specialists on the units. And we included a pre and post test with identical answers to determine how effective the education was on the staff. So graph A included what behaviors might be seen um, in a mother experiencing postpartum depression. And this was a select all that apply question on the pre and the post test. And we found that comparing the pre and post test responses, there was at least 20% increase in education based on the fact that they were able to identify more common more common symptoms. Group B was a focus on a question about screening tools for postpartum depression and how confident the nurses felt using them. The pretest showed a fairly equal split of responses, with 25% responding they feel confident using them and are aware of when best to use them, 25% saying they knew how to use them, but not necessarily when, and the other 20 and another 25 saying that they only have basic knowledge of screening tools, and then the other 25% reporting no knowledge. The post test showed 12% still felt that they didn't know anything about screening tools, which tells our team that the education was not adequate enough for some of the population that we provided education to, which was great feedback for us. And 12 still reported that they did not know how to use them or when to use them. However, 60% reported feeling confident using the screening tools and understanding when best to use them. And no one reported having only basic knowledge in the post-test. Graph C visualizes the responses to our questions, asking what kinds of resources are available to nurses. The question targeted the portion of our presentation regarding resources, which included resources specific to Cincinnati Children's Hospital Medical Center, as the education was provided to the nurses in their NICU. In the pretest, we see it's a 50-50 split. And in the post-test is about the same. So, in conclusion, our sample size was fairly small, and in the same time, we had to complete our intervention. And so we were interested in continuing to receive responses in order to develop better understanding of our findings. However, based on the responses we did receive, it is clear to us that we need to adjust our education model to include more detailed information regarding postpartum depression screening. While the module seemed to be helpful to most of the nurses, some were still dissatisfied with the information in this particular section. We plan to make these adjustments and then redistribute the module to the nurses and possibly expand our population to other units within the hospital that also see infant patients, pediatricians' offices, OBGYNs, and others. And then here are our references, and thank you for listening.